5:09, 5:10 now, Friday press box. We're at Sacred Heart Griffin. We're now in our Springfield Clinic Orthopedics session that we have every Friday at 5 o'clock. Dr. Brett Walters from the clinic is with us, and we're going to talk shoulders today. Doc, what's the most common shoulder injury that you see?
Mostly rotator cuff injuries is probably the number one injury I see in my clinic, whether it's an injury or a chronic repetitive type overuse situation.
What's the most common shoulder injury for football? Is it still that?
I would say it's more of a labral tear or shoulder subluxation, so an athlete gets driven down to the ground and basically their shoulder comes out of socket either in the front or in the back. Linemen tend to get more of a posterior shoulder subluxation injury, or we call a posterior labral tear, whereas your defensive players or your receivers or running backs tend to have an anterior subluxation or shoulder injury. Other common ones could be a shoulder separation, which is not the joint coming out, but actually where the collarbone attaches to the shoulder, that separates. That's another common shoulder injury we see in football.
What can an athlete do to prevent a shoulder injury?
I'm not sure there's anything you can do to prevent it necessarily besides, if you're talking about a shoulder subluxation or a shoulder separation, but because it's more of a traumatic thing that happens as you fall in the wrong position. Right. Whereas, the overuse injuries, such as if you're the baseball pitcher or the quarterback and you're throwing the ball repetitively multiple times, those things, stretching and strengthening of the shoulder can prevent most of those injuries.
And most of those muscles you can't strengthen those muscles with the big weights. It's the smaller weights, right?
That's correct. Like anywhere from 2 to 5 pounds usually, or using a TheraBand is the normal technique we usually recommend for athletes.
When somebody injures their shoulder, what do? How do you treat it?
Well, first you got to make the correct diagnosis. So you take your history. Was there an injury or was this an overuse thing? What type of work or sport do they play? How does it affect them? When does it bother them? Does it bother them at night when they're sleeping? That's a sign of a rotator cuff injury more so than a shoulder instability problem with a labrum. So it depends on, getting the history usually leads you to your exam tests. The exam tests we do typically focus on range of motion, strengthening, and then special tests that allow us to determine is there any evidence of shoulder instability or any weakness of the rotator cuff, or is there any loss of range of motion, such as in an older patient, arthritis, or some younger patients get a frozen shoulder, which is not something we see quite frequently.
Before a game, number one, we see guys with knee braces. We see ankle supports. There's nothing like that for a shoulder, is there?
That's
nothing you can physically wear, or is there?
There are things you can wear. There's different degrees of restriction that these braces can give you. So There's about 4 or 5 different types of braces that athletes wear. You can't see them because they're underneath the pads and the jerseys. So many of these athletes we'll be seeing out here tonight will probably be wearing some of these harnesses, if you will. You just can't see it. And what you'll notice is that if it affects one shoulder or the other and they're wearing it, that they can't get their arm up in the air in a certain position.
I was going to say, what are the limitations that those things present?
So depending upon what type of position you play, you'll put the athlete in less or more range of motion restricted braces. So if you're a lineman, you really don't need to get your arm up in the air that much. Right. So you're going to have a more restricted brace, whereas if you're a receiver, you're going to have a less restricted brace in general. And
we see athletes out here, we see them doing stretches. Is there any sort of stretch you can do to loosen up your shoulder?
Yeah, there's a number of exercises that I recommend for patients that have chronic shoulder pain related to rotator cuff injuries. Those focus on what we call posterior capsular stretching exercises. That's simply bringing the affected arm across your body, in front of your body, and holding it. Also doing a towel stretch where you put that arm behind your back and then you put the other arm on top of your head and use a towel to elevate it. Or there's another specific stretch called the sleeper stretch that is very effective at basically stretching out that posterior capsule of the shoulder to prevent rotator cuff problems.
Shoulder injuries, when you have them, is there sort of a template for recovery time?
It depends. the same athlete that has the same type of tear may respond differently. So if you look at tonight, if somebody goes down with a dislocated shoulder, in some cases that athlete may be able to return to sport the same night without a brace and have no problems. The same athlete who has that injury could have just repetitive instability because the tear is a little bit larger, or their rotator cuff compensates for that labral tear. So the labrum is a gasket that goes around the shoulder socket, and depending upon, it goes 360 degrees around the shoulder socket. So if it only goes, say, 10 or 20% around the shoulder socket, it may not affect that athlete that much. Whereas if it goes around 90, 180 degrees, it may be more preventative from them being able to do their sport, or it feels like it comes out all the time. And when it gets really bad, some people feel like at night it comes out of sleep, or it'll come out of sleep if they're washing their hair and they got to go to the emergency room to get their shoulder reduced. So that's a problem.
In the old days, you could pop the shoulder back in. Is that possible? Is that done on the sidelines?
Yes, many times. Some medical professionals feel that an x-ray is needed first. I don't know that that's always necessarily true. If you can get the athlete to relax, at least you get them in a better position, because if you get them on the field and get it right away, you can get it back in without any anesthesia. A lot of times by the time they get to the emergency department, they wait through the waiting room, they get their x-ray, they're really stiffened up and cramped up, and it's hard for them to relax, so you need to give them either anesthesia or a local anesthetic to try to get them to loosen up.
Dr. Brett Walters, when you guys... Surgery is sort of a last resort, isn't it? When do you go to shoulder surgery?
So we'll break it down into two situations. So the first is the rotator cuff. So if somebody is working and they can't work, and they've got a full thickness rotator cuff tear, and they have weakness and they have pain at night, certainly that would be an indication for shoulder surgery to repair the rotator cuff. If someone has a full thickness rotator cuff tear, they have full range of motion, good strength, minimal pain, many times we'll try to rehabilitate them, get them through physical therapy, maybe an injection, and sometimes people can continue to live with that and do just fine. So just once again, it depends upon the individual, how they compensate, what type of work they do. If you talk about the athlete, for the labrum, in general, we try to wait to the end of the season to do the surgery. Typically, unless
play through it?
Yeah, they can play through it. Most athletes can actually play through a shoulder subluxation, so maybe they're out a week or two. They get their motion back, they get their strength back. We put them in a brace, and many of them can complete the season and then decide, okay, now I got to go play basketball. I know basketball is my main sport, so I'm going to wait till the end of basketball season actually to do this. So, or they don't play basketball, but they do something in track, so they want to get it done as soon as the football season's over. So a lot of it's timing based upon what other sports they play.
Recovery time from shoulder surgery?
So in general, both of those things, I tell patients about 4 months. If it's a full-thickness rotator cuff tear or a labral tear. If it's a larger tear of either the labrum or the rotator cuff, sometimes it's 6 months. But in general, that's a normal process to return to sport.
Is this a sleeping in the recliner surgery most
definitely? Most definitely.
You're headed to Williamsville tonight. You have a football game. Have you been all 5 weeks? Have you been out this year?
I've been either at Williamsville or at Athens.
Okay. Dress warmly tonight because I have shorts on, but I'm going to be sitting up here. So have a good time at Williamsville today. Thank you for visiting with us.
Thanks,
appreciate
Jim.
it, Dr.
Appreciate
Brett Walters from Springfield Clinic Orthopedic Sports Medicine. Where are you based mostly? Where's your office?
I'm at the 800 building right across from Memorial Medical Center.
Okay. Just
in
there,
Springfield.
Just there yesterday. Got my hip replacement checked out, and I'm a year in, and I'm doing fine.
Fantastic.
All right. Hey, we'll be back after these. That's Dr. Brett Walters, Springfield Clinic Sports Orthopedic. Back after these.